Is Britain's National Health Service in crisis? Prime Minister Theresa May insists the NHS is better prepared for the winter than ever before. But tens of thousands of operations have been cancelled, leading other politicians to accuse her of being out of touch and warned her that she is burying her head in the sand. Even the politician in charge of the health service, Jeremy Hunt, admitted the NHS needed substantially more resources to cope with the huge pressures it faced. And that's not all. The Conservative chair of the Commons Health Committee, Sarah Wollaston, told May to get a better grip on the health system. Health staff have also taken to social media to condemn the situation, revealing they are ashamed of the substandard care the NHS is offering. Others branded the crisis as battlefield medicine. Meanwhile, Niall Dickson, the chief executive of the NHS Confederation, which represents organisations across the healthcare sector, said health services were under intolerable strain, and the extra money put in by the government had been too little, too late. A number of ambulance services are also under severe pressure, with two even resorting to taxis to ferry patients to hospital. The NHS added that restrictions on mixed-sex accommodation should be temporarily lifted to deal with overcrowding. Why has the NHS cancelled so many operations? And to what extent has Conservative funding policy towards health caused the current problems? Simple questions with important answers. Theresa May emphatically claims the NHS is better prepared this winter than ever before. Yet we have claims of a winter crisis. Why did she make that statement? We asked the public, and here's what they told us.
I think she's made a statement because she probably has put more money into the NHS, but the reality at the chart face for those who are delivering services is that they are incredibly under pressure. So Theresa May is telling a truth, but at the same time she's not telling the whole truth because she's missing quite a lot of information out.
Theresa May, maybe she's not allocating the correct funding to the NHS system that we have.
I think everyone is running scared in Parliament at the moment. Working on the front line, the system is not prepared. We knew flu was coming. We looked at Australia months ago, saw this flu was coming. We know that we're massively understaffed. We know that social care is struggling, and as a result we can't get people out of hospital as fast as we need to. And so this issue is not just about the NHS, this is about care across our country, and we're not getting the care we need for our patients.
I think it's a political reasoning, party politics. Because we've had problems with NHS before in terms of the A&E and the funding, and that's why she's come out. She's been discovered, she's been found out about the failures that the government's been making with the NHS and the funding of it.
Why do I think she made it? Well, she's trying to cover her backside. I don't think the NHS has got the resources. It isn't kind of keeping pace with the kind of changes that it needs to. So it simply doesn't have the resources and the people power that it needs to kind of. So I think Theresa May's claim is a little exaggerated, shall we say.
I think she's quite desperate for any positive news. At the moment she seems to be very keen to, obviously all that she seems to be able to focus on is Brexit, and I think that anything that she can treat as good news, and I think she jumped on that one before realising the severity of the situation.
I doubt if she knows anything that we don't know. My impression is that she doesn't know too much at all. I have a really good impression of the NHS since I've been here. And I think they're in crisis because they need help and they need support, and I think they're doing a great job.
I think the NHS is a great thing, and I think that possibly our government is informed by managers and not people within the NHS, like the doctors, the nurses, the people that are running the business. So I think she's probably getting misinformation from a bunch of bureaucrats.
Theresa May seems to have this knack of coming up with these mantras like strong and stable. I think that's just the way she operates, and the more you repeat a line, the more likely that people will believe it. And it's also a way of kind of keeping the sort of media and the public at bay. So it sounds like she's on the case, but really she's just trying to sort of deflect the attention away from the government. I mean, Jeremy Hunt has sort of said the same thing about the NHS, about the crisis last year. You know, he's repeating the same spiel every year. So they're obviously trying to keep the public at bay and sort of keep them away from seeing what they're actually up to. And I mean, things like closing the walk-in centres, that's kind of a new story. If they are serious about saving the NHS, they wouldn't be shutting the walk-in centres at the same time that they're saying the NHS is safe in their hands. So it's sort of shallow words.
So Theresa May is misleading the population. We are not prepared for any extra strain within the NHS. We've lost 15,000 beds since 2010 within the NHS. We've seen a squeeze on social services budgets, so more people are finding it hard to get back discharged into their nursing home. If you combine the loss of beds, the pressure in social services, you can see that this was a crisis waiting to happen. We had a problem last year when the NHS was declared as a humanitarian crisis by the Red Cross, and this year we're seeing the same again. So the NHS is not prepared for this. In fact, Theresa May needs to use continuous bad headlines that the NHS is attracting to undermine the public confidence in the NHS, and that's what the agenda is here.
NHS hospitals have already had to cancel over 55,000 operations to free up beds and medical staff. And 17,000 patients had to wait in ambulances for over half an hour during the festive period. What are the public's thoughts on this?
It's disgusting. It's disappointing. It's definitely if the appointments are cancelled, like people are working themselves up to it for whatever they have to get done. So it's disheartening. It's like their lives are put on hold. And then if you're in an ambulance, yeah, it's not good, not good.
The fact that they've been cancelling operations just shows that there's a lack of funding that's going around the country. And of course, the effect of this is people receive less care, and it just has more of a drain on our society because you have to pay for people to stay well, and the fact there is less people in the working industry, there's less money to flow, which inevitably affects the situation with the NHS.
I think if this is the best plan they've got, then that's really disappointing, because all it's going to do is have a massive knock-on effect, not only for the healthcare system going forward for the rest of the year, because we're going to have to pick up those operations somewhere in the next 12 months, but also for the patients whose operations have been cancelled. These operations may well be elective, but that doesn't mean they're not necessary, and there are a lot of people sitting at home at the moment in considerable amounts of pain, very, very scared, wondering when their operation's going to happen.
It's appalling. It's a disgrace. It's an absolute national disgrace. It's awful. Yeah, and something should be done about it really urgently. And just platitudes from the Prime Minister's not helping anybody. People are suffering and she needs to do something about it.
I think it's a disgrace. It's an absolute disgrace. I don't know what else they can do, though, apart from vote out the Tory government and maybe replace them.
I think it's intolerable. We would call ourselves a civilised society in which we kind of care for our people. We all pay taxes. That just shouldn't happen. It's absolutely not, shouldn't be allowed.
I think it's totally unacceptable, and it is appalling, and there has to be a better way of prioritising, of freeing up beds. I personally believe that the answer lies with social care. We have to find a way of freeing the beds to make room for the urgent cases.
I think the NHS needs more money.
Well, it doesn't really surprise me because in light of their policies thus far, I mean, they're not actually cancelled; they're being postponed. But you're right, you know, it's putting things back and delaying things. But again, it's another sort of tactical way of getting the people to think, well, they're prioritising, so you know they have to do this, and they're delaying, you know, the operations. But it's just highlighting the cracks. And if you think about in the last 30 years, literally half the hospital beds have been lost due to either closures or mergers or selling off of the NHS land. So this is no accident. It is an emergency, but it's not an accident. And it's government policy. You know, they've pressurised, they've reduced the sort of student bursaries, so there's no sort of staff coming in, and the junior doctor's contract has been forced down so much, and it's such an appalling contract that they are leaving too. So it's no surprise that staff are leaving.
The cancellation of so many operations for patients means patients waiting longer, suffering longer, in pain, and not having their needs met. This is a huge problem for the NHS. Ambulances waiting outside hospitals to drop off patients show that there is a chronic lack of capacity within the hospital. Cancelling routine surgery may not even necessarily help this strain, because if you're having day case surgery, you are not freeing up a bed. We have a problem with capacity, and the knock-on effect on patient care, well, the quality is going down. We've got seriously sick people waiting in ambulances to be even assessed within the hospital. And this puts their lives at risk. And we've heard already that people have died waiting in corridors. We've had doctors and nurses struggling to assess patients in the back of ambulances.
Does the public think years of Conservative cuts and underfunding played a part in the NHS crisis, and why?
That we've been in a period of austerity and the government have felt that that was necessary, but again it's about the honesty of the debate. So yes, I'm sure it is as a result of the austerity measures that have been taking place for a protracted period of time. You can't deliver a high quality public service without the funding that goes into it, and that has a cost to the rest of society. So it's about honest debate.
I'd say it's been ongoing for a while, you know, because you've seen it in the papers and on the news for a long, long time. Like, yeah, they outsource things and not enough money.
Cuts overall, full stop, the Conservatives have implemented into our country.
We have been saying for years, as a junior doctor, we have been screaming from the rooftops for years that we do not have the funding we need, not only in the health service but in social care, and we're seeing the results of that now. None of this has come as a surprise to anyone who works in the health service, anyone who works in social care. It's all out there, we've been saying it's going to happen, and now we're seeing what the effects of that are.
Well, to be fair, I think it's the successive governments that's caused that. Tony Blair started to privatise the NHS before he left. Gordon Brown continued. And Theresa May just following through the policy because they don't want to maintain the NHS. Now, in terms of the costs, they rather private organisations take over the debt rather than being the public purse. That's what I think anyway.
Absolutely, yeah, of course they do. I mean, I don't have the facts, I'm not a politician, so I don't have the kind of like the statistics with which to support those kind of, but it's clear that it does. If you follow the news and you're an engaged person, which we all should be, because we should care about our society, then yeah, absolutely that's the case.
Undoubtedly, it's affected everything, but you can't spend money you don't have. So again, it's a much bigger and a very much an ongoing situation.
I think the cuts have definitely affected it, but I think also we need to take a deep look at what our expectations are of the NHS. I'm not an advocate for plastic surgery on the NHS and various other things. So I think someone with common sense at the top has to say, this is what the NHS does. And if you want new breasts or a facelift, then you go and pay for it privately.
Oh, it's definitely played a part, and they've been in power for 7 years. Part of that was with the Liberal Democrats. But this is a 30-year agenda. And so New Labour very much played a part in that as well. But obviously of late, the Tory government are the ones who are implementing these cuts and closures. So yes, they are to blame. I mean, the NHS budget should be increased by 4% every year. And although they're saying that they're putting more money than ever in, they're actually only putting in an extra 1%. So although it's 1% more, it's 3% less than it should be. So that's why you're starting to see the cracks. I mean, things like the public sector pay cap as well, that's adding to it. I mean, that's although they're freezing their pay, in effect it's a pay cut, so that's demoralising the staff too as well. And the 5-year forward plan has actually asked for £22 billion of saving every year. So we're talking savings, we mean cuts and closures, so you have to read between the lines.
Since 2010, we've seen a deliberate defunding of the NHS. Historically, the NHS has received a 4% increase in their budget. But since 2010, under the cloak of austerity, we've had an average 1% increase. Now demand is going up and the funding increase has not kept pace with demand. So clearly the NHS has been struggling. It's not receiving adequate resource. As a result, staff are finding it harder to cope. And don't forget, the staff have had a pay freeze since 2010, roughly losing about 15% in real terms. So you've got a double whammy. You've got staff being inadequately resourced to do their job and having a pay cut. And this is leading to a hemorrhaging of staff, a problem with recruitment and retention, and the care that they're able to deliver with lack of resource is declining.
Official figures show private sector outsourcing has reached nearly £9 billion, or 8% of the budget, up by around 100% since the Conservatives came to office in 2010. At the same time, over 60 NHS trusts faced downgrades, closures and mergers. NHS cuts will amount to around £40 billion in real terms by 2020.
Some say the Conservative government is leading the British health services towards an American-style insurance system by making the public lose confidence in that service. Does the public agree, and why?
Well, definitely. Considering what's happening with the Brexit situation, I believe that is where the country is headed towards. And unfortunately, because there's still a large proportion of this country which is on benefits, I do not think it's going to be helpful for our society.
I would be very surprised if there isn't. I think we are seeing a massive privatisation of services. Virgin Care is taking over a lot of services across the country, and that's really quite concerning. I think we need to have a serious look at how our health service functions, how our health service is funded, but also how our health service is expected to pick up the social care work when we've cut that so drastically. So I think privatisation is an issue, and I think people need to be aware of that.
I think that's the underlying policy, that it is to eventually privatise NHS. I think that's what Jeremy Hunt has in mind, and I think that's why things have gone the way they have. We spend less of our gross national product on the NHS than any other country in Europe, and it's absolutely appalling. And I think it's deliberate policy to drive us towards more privatisation.
Well, I think the NHS is a public service, so it's for the betterment of the people, rather than making a private cost for people to pay directly. I think it should be collected centrally from taxes, income taxes, national insurance contributions, because a lot of people don't have the money for the upfront costs of operations and medication, so I don't know how that will work in terms of working class people.
You don't want that. You don't want an American system. Absolutely the last thing that this country needs or wants. It's intolerable, and it's a massive countrywide scam.
I really hope not. I think our NHS is brilliant and we need to protect it at all costs.
I don't think it'll happen. The NHS is too big an employer to lose that many staff, and I simply don't think that no politician will come out and say they are against the NHS because it's an immediate vote loser. So they simply can't. I don't think anyone would have the gumption to do that. However much it was costing, I think it would affect too many people who have access to polling stations, and therefore it just wouldn't happen.
All I can say is I hope not, because I'm American and it sucks.
I don't think they are. No, I don't think that's it. I think the people that want to pay can pay, and I think what they need to look at is what kind of service they give and stop giving the lifestyle service, that I'm seeing them give as well.
I absolutely agree, because the Conservatives are they're ideologically behind this idea. They do not believe that public services should be run by the government. They believe it should be run by private interests. And that's happening across the country and internationally. It's not just an English problem. And with the Health and Social Care Act in 2012, the government's responsibility to provide us with healthcare was actually severed. So they are literally not in charge of the NHS anymore. The person who is Simon Stevens, who's head of NHS England, and his previous post was in charge of overseas development for United Health in America. He has a private insurance background, so he's a privatiser and he's at the helm of the NHS as we speak. So their actions say otherwise. I mean, it's a classic example. They run down public services, they underfund them, they demoralise them, then it looks bad in the media, and then the privatisation is offered as a solution, whereas it's always been the agenda all along to privatise a public service against the wishes of the public.
I completely agree with that statement. If you just have to look at the legislation that the Tory party brought in, the coalition brought in 2012, this legislation effectively abolished the NHS. It changed the role of the Secretary of State. No longer was there a duty on government to provide healthcare, but it changed to a loose term of a duty to promote. Now this is legally carries no weight. So the NHS was effectively abolished, and we've had 7 years of contraction in funding increases. So you can see that there will be erosion of public trust. But the other thing that happened in the 2012 Act was the creation of clinical commissioning groups. And these are state-owned insurance pools ready to be switched into privately owned insurance pools, which is being set up behind the scenes as we speak.
Does the public have confidence in Prime Minister Theresa May's ability to fix the NHS crisis? And how can that crisis be fixed?
I don't personally trust this government at all when it comes to an honest discussion about public sector, the funding that is needed, the pressures that the public sector is under, and what that means in terms of our taxation system and how we choose to spend our money. So the answer is no, I don't.
I trust the NHS. I don't trust Theresa May.
Why not?
Because I think she has had many, many warnings about what was going to happen. I think we are seeing horrendous scenes across the country in hospitals and in the community services. Nobody can say she didn't know this was coming, and instead of getting up and doing something active about it, she's rewarded Jeremy Hunt.
No, I don't have confidence in her at all.
No, I don't. I think she's a lame duck and she needs to go. Someone should have come in and represent, take over from her. So that's what I think anyway.
No.
Yeah, I believe that she's going in the right direction. It's just not going to happen quickly enough. Something needs to happen right now. But equally, Jeremy Corbyn is spending money he hasn't got, so that's not going to work either. There's no quick fix, is there?
I don't think she'll be in long enough to do it. I think that sooner or later she's going to have to realise that a coalition with the DUP simply won't work. I think the pressure from Brexit will become too much. I think that there's going to become pressure for another referendum on the EU because a lot of people, I think, who voted to leave will probably, even if nothing else, constantly, that's all you ever see in the media. I think if there was another referendum, I think it might go the other way.
But I have a really bad impression about Theresa May, and I don't think she's going to be the one to help the NHS.
Theresa May won't fix that. Someone needs to shake up the NHS who is a doctor or is a nurse or is a manager. That's where I think the problem is, grassroots.
I don't have any confidence because her and her party are against public services. They want to privatise them, and so that's how we're seeing it playing out. So I don't have any trust. We need to nationalise the NHS, no question about it, and to save us from any, from being immune to free trade deals, which often call for public services to be privatised. We need to nationalise the NHS, and then it will be safe, hopefully, from future free trade deals. We need to fully fund up to 4% budget increase every year, as I've said before. We need to remove all the market forces and administration that's built up from 4% in the 70s to over 20% now. So if you translate that into a budget, it's around about an extra £15 billion a year is being lost on the NHS. So if we're talking money, that's where the money's going. End the public sector pay cap, reinstate student bursaries, and stop these STPs, which is Sustainability and Transformation Partnerships, which are enforcing these cuts and closures that we see.
I have absolutely no confidence in this government or Theresa May to fix the crisis. In fact, they have created the crisis. There is no political will within government to reverse what they've been doing to the NHS. What we are being served up is diversion, scapegoating, and lies about the NHS. They're trying to blame the patient for the crisis. They're trying to blame the staff for the crisis. But the reality is deliberate underfunding and contraction of bed capacity has led to this crisis, so the government can paint the NHS as failing, and meanwhile they're lining up the insurance industry and private providers to take over a failing NHS, and they're also trying to persuade the public that the model of the NHS is no longer sustainable and something else needs to be done. And we can see the narrative for softening us up playing out in mainstream media.
The British Red Cross declared a humanitarian crisis in the NHS. Doctors and managers say they have never seen it so bad, with trolley queues, ambulances stacked up outside, and no free beds for those with flu and other winter-related illnesses.
An increased demand for NHS services in winter is normal. What's not normal is the longest squeeze in funding the NHS has ever known. The lack of nurses and doctors was planned, and cutting nurse training was an early act of the Conservative administration in 2010. This leads many to say that the current winter crisis wasn't caused by bad weather, it was caused by bad government.